Good news, folks. Last month, your health insurance premiums went down by 34%. At least that's what you're supposed to believe, according to the inflation statistics that were just released today by government bureaucrats who think you're stupid and expect you to believe that. What's up, guys? I'm Nobody Special, and this morning we got the October CPI, or the Consumer Price Index from the Bureau of Labor Statistics, and the market was celebrating because inflation was only 3.2% year over year, and the market was expecting 3.3%, so the lower inflation report sent stocks flying. There's one problem. The entirety of that inflation beat was made up of a methodology change to the way we measure inflation in health insurance, and if you correct that number, inflation actually came in higher than the market was expecting. And here's the CPI report from the BLS this morning. The all items index increased 3.2%. That's the year over year change, and that's the number that everybody was celebrating. And as some very sharp eyes on FinTwit quickly noticed, there was one big outlier in that report in Table 2, where they give you a detailed breakdown of all the categories that make up the CPI. Right here above my head, health insurance premiums dropped 34%. And if you factor in the weighting of this category, health insurance accounts for 0.525% of the total index. The entire index was dragged down almost 0.2% just by this one category. And obviously anybody living on planet Earth, that is outside of Washington, D.C., knows this number is complete horse manure. Also worth pointing out that 0.525% number is also horse manure. How many people out there really only spend 0.5% of their income on health insurance premiums? And as always, folks, the answer lies in the fine print. There was a change to the health insurance methodology following recommendations from the National Academy of Tell Them What We Want You to Say or We'll Cut Your Funding. The Bureau of Labor Statistics is improving the methodology used to calculate retained earnings in the CPI Health Insurance Index. Under the pre-October 2023 methodology, retained earnings were updated annually without any smoothing of the data. Under the new method, the BLS will update retained earnings every 6 months using half-year data and will calculate on a 2-year moving average to smooth the changes in retained earnings. I don't know what any of this stuff means. All I know is they changed the way they measure things, and all of a sudden, voila, your health insurance drops 34%. That is not rain dripping down your back. Now let's see how that 34% decline in health insurance premiums in CPI measures up against some of the real-world data. For example, this headline in the Wall Street Journal from just a few weeks ago: health insurance costs are taking the biggest jumps in years. Employers and workers are expected to see an increase of about 6.5% or higher in health plan costs next year. Or how about this one in NPR from last month? For people who get health care coverage through their jobs, the cost is rising. Well, that must be a typographical error. Surely they meant to say the cost is falling 34%. Or maybe this one from U.S. News and World Report: U.S. health insurance premiums rise 7%, nearly $24,000 for family coverage. So besides the fact that the 7% increase in your health insurance premiums is turned into a 34% decrease in CPI, remember the weighting of the CPI index of 0.5%. That $24,000 for family coverage represents apparently just 0.5% of your income. Congratulations, you guys are doing great. So I feel like a congratulations is in order to our government benefactors after decades of nauseating speeches about bringing down the cost of healthcare. Apparently they've finally done it. 34% lower. All we had to do is change math. Also important to remember that the stock market rallied on this news today. The S&P 500 gapped up almost 2% at the open in another totally organic price move for stocks based on manipulated government statistics. Remember, if it wasn't for that 34% reduction in health insurance premiums, then the CPI would have come in at 3.4% today, 1 point above the 3.3 the market was expecting. And so this rally in the charts would look a little bit more like, there, I fixed it. So now that healthcare has finally become affordable, and now that inflation is totally defeated and everybody's lives are getting better, I guess we can look forward to an end to the videos of girls in their cars complaining about how they can't afford life anymore because the government bureaucrats say, girls, you're wrong. Your life is better. Think I'm kidding? Just ask former Fed economist Claudia Sahm, who says the vast majority of Americans are better off financially. Full stop. Till next time, live small and dream big.